Did you know your body can warn you about a stroke weeks before it happens? These aren't dramatic alarms, but subtle whispers, signals we often ignore. We're taught to push through, to dismiss little aches and moments of weakness as stress or fatigue. But listening to these signals could save your life. Today, we'll uncover the early warning signs of a stroke, not to create fear, but to empower you. Knowledge is power, the power to act, to seek help, and to protect yourself and your loved ones. We'll explore what these signs are, how they feel, and why you can't afford to ignore them. Let's begin this journey and learn the language your body is speaking. One of the most common, yet often overlooked warning signs of a serious medical emergency is sudden numbness or weakness, especially when it appears on just one side of your body. This isn't something that builds up over days or weeks. It can happen in an instant, catching you completely off guard. Imagine reaching for your morning coffee and out of nowhere your hand feels weak and unsteady. Or maybe you stand up to walk and your leg drags behind you, refusing to cooperate. Everyday actions, like buttoning a shirt or holding a fork, suddenly become difficult or impossible. This isn't a gradual ache or soreness from overuse. It's a sudden, unexplained shift in your body's ability to move or feel. It can be deeply unsettling, especially if you've never experienced anything like it before. The key clue: this weakness or numbness almost always affects just one side of your body. It might be your face, your arm, or your leg, but rarely all at once. This is your nervous system sending a distress signal. Unlike the tingling you get when a limb falls asleep, this weakness is more profound and persistent. It's often painless, which makes it easy to brush off or ignore, but it's far more serious. You might think, I must have slept on it wrong, or maybe I just need to stretch it out. But ignoring this symptom is a risk you simply can't afford to take. Sudden weakness or numbness could mean a blood vessel in your brain is blocked or narrowing, cutting off the oxygen your brain cells desperately need to survive. Sometimes the feeling comes and goes within minutes. This is called a transient ischemic attack, or TIA, often referred to as a mini-stroke. The symptoms may disappear, but the danger hasn't passed. But there's nothing mini about the warning it gives. A TIA is a major predictor of a full-blown stroke, a precious window to act before permanent damage occurs. It's your body's urgent alarm bell, not to be ignored. If you feel sudden numbness or weakness in your face, arm, or leg, especially on one side, treat it as an emergency. Don't try to tough it out or wait to see if it gets better on its own. Don't wait to see if it goes away. Every minute counts when it comes to your brain. The word to remember is sudden. Sudden change means urgent action. One moment you're fine, the next, a part of your body feels disconnected or unresponsive. This is not the time to wait it out or hope it will pass. Acting quickly can make all the difference. Seek immediate medical help and say, something is wrong and I need help now. Don't downplay your symptoms or hesitate. Your life and your future could depend on it. Listen to your body's 911 call. Honor the signal. Act fast and give yourself the best chance for recovery and a healthy future. Imagine being in a conversation and suddenly, your words come out slurred or jumbled, or you can't speak at all. This isn't a simple slip of the tongue. It's a sudden, profound difficulty with speech. Or maybe you can't understand what others are saying. Their words sound foreign, the meaning lost. This is a classic sign that the language center of your brain is in trouble. It can last just a few minutes, then resolve, tempting you to dismiss it. But even a brief episode is a critical warning. A TIA, a sign of a clot or narrowed artery. If you or someone else suddenly slurs words, can't repeat a simple sentence, or seems confused, act immediately. Ask them to smile, raise both arms, and speak a simple sentence. If they struggle, call for emergency help. Don't assume it's fatigue or embarrassment. Recognize the urgency. This is your brain's call for help. Don't hesitate. Every second counts. Sudden vision problems are another crucial warning sign that should never be ignored, especially as we age. These changes can come out of nowhere, catching you completely off guard and leaving you feeling anxious or confused. This isn't the slow, gradual vision loss that comes with aging or needing new glasses. It's abrupt and dramatic. You might suddenly experience blurred vision, see double, or even lose sight in one or both eyes without any warning. Sometimes it can feel as if a dark curtain has dropped over part of your vision, blocking out the world in an instant. This often happens without any pain, making it even more unsettling. You might instinctively rub your eyes, hoping it's just a floater or some dust, but this is actually a direct message from your brain that something serious is happening. The real issue is that the visual cortex or optic nerve in your brain may be losing blood flow, which can disrupt the signals your eyes send to your brain. These symptoms can last just a few seconds or minutes, then vanish as quickly as they appeared. Because they're so brief, it's easy to brush them off or forget they even happened. But any sudden, unexplained vision loss or disturbance is a true medical emergency. Don't assume it will go away or that it's harmless. These episodes are often caused by a TIA, a transient ischemic attack, which is a powerful predictor of a future stroke and should be taken very seriously. Don't wait for an eye doctor appointment or hope the problem will resolve on its own. Seek immediate medical attention, even if your vision returns to normal. Remember, the problem is likely in your brain, not your eyes, and only a medical professional can determine the cause and provide the right treatment. Quick action can prevent permanent loss of vision, or even stop a major stroke from happening. Every minute counts. Reframe your thinking. Sudden vision changes are not just inconveniences, but red alerts from your body that demand urgent attention. Don't delay. Get help now and protect your vision and your life. Sudden dizziness, vertigo, or loss of balance can signal a stroke, especially if it comes out of nowhere. This isn't the lightheadedness from standing up too fast. It's a profound, disorienting sensation. You might stumble, veer to one side, or find your hand missing its mark. These symptoms often point to trouble in the cerebellum, your brain's coordination center. It can feel like walking on a ship in a storm, sometimes with headache or nausea. People often mistake this for an ear problem or fatigue, but the suddenness is key. If you suddenly can't walk straight or feel intensely unsteady, treat it as a red alert. Don't try to sleep it off. The cerebellum is sensitive to blood flow disruption. Delays can be dangerous. Call for help right away. Sudden balance loss is a neurological emergency. Don't ignore it. Act immediately. Most headaches are harmless, but a sudden, severe headache, the worst of your life, can signal a stroke. This thunderclap headache comes on instantly, with excruciating pain. It's often a sign of a subarachnoid hemorrhage, when a blood vessel bursts and bleeds into the brain. Unlike migraines, this pain is abrupt and overwhelming, sometimes with neck stiffness, confusion, or vomiting. It's a catastrophic event, your brain's alarm bell. Not all strokes are caused by clots. Some are from bleeding, and these are often more deadly. Don't normalize this pain or wait to see if it passes. Every second counts. If you or someone you know experiences a sudden explosive headache, call emergency services immediately. Don't drive yourself. Call an ambulance. Medical help on the way can save your life. Don't try to tough it out. Recognize the urgency. Respond without delay. We all get tired, but a sudden, overwhelming fatigue can be an early warning sign of stroke, especially in women and older adults. This isn't tiredness that sleep or coffee can fix. It's a deep exhaustion that comes on suddenly, without reason. You might struggle to get out of bed or find simple tasks exhausting. Your body may be working overtime to manage a crisis, diverting energy to deal with blocked arteries. This fatigue is easy to dismiss, but if it's unusual and persistent, pay attention. For women, this can be a primary clue, often more subtle than classic symptoms. The key is change. If you're normally energetic and suddenly drained, that's a red flag. Don't ignore it. Discuss sudden, severe fatigue with your doctor. It could be your body's quietest warning. Listen to your energy. Facial drooping is the most recognized sign of stroke, a clear, visible signal that something is wrong in the brain. It's a moment that can be both shocking and confusing, especially when you see your own reflection and notice that your face isn't moving the way it should. This sudden change is your body's urgent way of telling you that something serious is happening. Facial drooping happens when blood flow to the nerves controlling your face is disrupted, causing sudden weakness or paralysis on one side. The nerves that help you smile, blink, or even speak clearly can be affected in an instant, leaving one side of your face slack or numb. You might try to smile and only one side of your mouth moves or one eyelid sags. Sometimes the difference is subtle at first, but it can quickly become more pronounced. Even simple expressions can feel impossible. Use the FAST test, F for face. Ask the person to smile. This simple step can help you spot a stroke in seconds, even if you're not a medical professional. Does one side droop? The asymmetry is usually obvious, but sometimes it takes a careful look. Compare both sides of the face for any unevenness or loss of movement. You might also notice drooling from the weak side. Everyday actions like drinking or speaking can suddenly become difficult, and saliva may escape from the corner of the mouth. This can be distressing, but it's a call to action. Recognizing these signs quickly can make all the difference for the person affected. Other conditions, like Bell's palsy, can cause drooping, but never self-diagnose. Only a doctor can tell the difference, and time is critical. Stroke drooping is often accompanied by arm weakness or speech trouble. If you notice slurred words or difficulty raising an arm, these are further red flags. Even if facial drooping is the only symptom, treat it as a stroke until proven otherwise. Acting fast can save brain cells and lives. When you see this sign, the clock is ticking. Every minute counts. The sooner treatment begins, the better the outcome. The sooner you get to the hospital, the better your chances of recovery. Don't hesitate, even if you're unsure. Facial drooping is your body's loudest alarm. Don't wait. Call for help immediately. Your quick action could save a life. We've explored the subtle whispers and loud alarms your body sends before a stroke. These signs, numbness, speech trouble, vision changes, dizziness, severe headache, fatigue, and facial drooping, are life-saving information. The key is their sudden onset. Don't rationalize or hope they'll disappear. Awareness and swift action are your best defense. Recognize the signs, seek immediate help, and never feel like you're overreacting. Trust your intuition and your body's signals. If you or a loved one experience these symptoms, call for emergency help. Your courage to act could save a life. Be well and stay aware. If you found this video helpful, please subscribe to our channel for more health tips and important updates. Your support helps us reach and help more people. Thank you.